Okay, so this is going to be part two of Should I Be Taking Medicine? Uh, my name is Jim McFarland. I'm a licensed clinical social worker, and I'm a licensed clinician in the state of Georgia and the state of Florida, and I specialize in anxiety. That's what I do. So then you're going to get an actual clinician of 25 years experience. You're going to get my experience with this. Now, this is for informational purposes only. It's not for you to decide whether you should be or not. It's to discuss and to bring up important things for you to discuss with your physician or with your own counselor or with your own therapist. Um, and hopefully you have a good anxiety therapist and that you're working with that. That's actually covered in another video, how to figure that out. Because I just see a lot of people out there that are just saying they treat anxiety and they do not. Just point blank. They're absolute full of shit, and they're not. So, okay. Second piece, part. This is part two. Part one talked about different criteria, different kinds of things that we look at as clinicians to determine if somebody needs medication or not. How much are they impaired? How much suffering are they going through? How long they went through? Is their sleep okay? Are they able to do the things? Are they impaired in driving and impaired in going to stores? And how much are they being hindered? How much anxiety is gobbling up pieces of their life or not? So in general, the intensity level of anxiety is 50 and below, roughly. If it's 40-ish, 50-ish most days, it's super uncomfortable for sure. May benefit from some medicine, and we discussed there were two different kinds of medicines that you could use in general. We're going to discuss some other classes too that are often used in conjunction with the first two. The first two classes of medicines are antidepressants. It's the first line of defense. They're super effective with anxiety. They really, really do help. And if you don't get results with the first one, you go to the second one and you try that. If you don't get results with the second one, usually the third one or a combination of a third and fourth will help to one degree or another. So we can really get some relief from these things. The second class of medicines, class number two, was the benzodiazepines. These would be the minor tranquilizers, and these are used to great effect with anxiety disorders. Physicians are a little bit more reticent and reluctant to. They're a little bit more reluctant to prescribe them, and rightfully because they're controlled substances. They do those. That second class does have the potential for addiction or to hook people, but if they're used properly and they're used the right way, they don't hook you. They're actually super healthy. They actually let your brain get a rest. They let you sleep. They let you kind of approach some of the things you're scary and absorb some of the teachings and some of the methodology and methods that you're going to have to use from a good anxiety clinician to overcome your anxiety. So, what are the other classes of medicines? Well, you'll see sometimes what will be used a little bit off label will be medicines that we normally call the antipsychotics. These are lesser used, but also used with anxiety disorders. They have an anti-anxiety effect when used in certain ways. So a lot of times they will use those. Mood stabilizers will be another one. Medicines like the Motrigine and so forth. Antipsychotics would be quetiapine and medicines in that class, risperidone and so forth. Those medicines are effective to a degree with certain kinds of anxiety and so forth. So sometimes physicians, and usually it'll be at a psychiatrist, will use these types of medicines in certain ways. So those are the other medicines that are kind of used with this. So what about, a lot of people will ask me, well, what about different herbs? What about herbs? Kava, valerian. And I'm just going to tell you flat out, real anxiety treatment that may help put a dent in some anxiety that's like 30-ish on a scale from 0 to 100. 100 is I'm losing my mind, I'm panicking, freaking out, losing my shit. 0 is none at all. About a 30-ish and below. Some of those medicines or some of those herbs can help a little bit. You got to be super careful. Things like St. John's wort, you got to be super careful, especially if you're already taking an antidepressant. St. John's wort, you can take that and it can cause serotonin syndrome if it's dosed the wrong way, if it's used the wrong way. So you got to be super careful with that. Serotonin syndrome is serious. You can actually cause yourself heart difficulties. You can create a whole series of different medical effects. What about valerian? What about kava? What about ashwagandha? What about do these work? In my experience, they do not. And I've been treating anxiety disorders for 25 years, and I had some clients that have used them to a degree. I think they can knock down anxiety a little bit, maybe from a 30 to a 20 or 30 to a 25 or a 50 to a 50 to a 45. But valerian tea and Gatucola tea and all of these, and I would absolutely avoid them because they have, what about tyrosine? What about, all of these kind of supposed GABA, that's another one, psychoactive, supposedly supplements. Do they actually help? Nope. So, and I hate to put a dent in the herb market, but it is what it is. I really can't stand when people are out there trying to market bullshit to people and trying to tell them that these things actually work to help this. I went through a stage where I tried valerian, I tried Gotukola, I tried ginkgo biloba, I tried tyrosine, I tried GABA, I tried all of these, and they didn't work. What did help was some medical advice from a good medical professional and some actual medicine. What actually helped me the most when I was in the heaviest stages of my anxiety, and that stage went on for years because I didn't get the right counseling help to really, with the real methodologies of what really works. And that's maybe in another video, we can discuss that, and what's out there as far as bullshit therapy. There are some therapy and some therapists that tout themselves as treating anxiety, but they're full of shit. They don't work. And I'm certified in all of the different gold standard treatments for anxiety. It is what it is. I'm just trying to give you 25 years of experience to kind of help you to wrestle your own anxiety and get it under control. So back to the medicines. I mean, sometimes the mood stabilizers will be used. Sometimes sleep medicines are used to help folks get better rest and so forth. We find that although rest isn't vital, it is part of what I call good amygdala management. So getting good sleep and having a good sleep hygiene routine. And I've mentioned this in some other videos with good sleep hygiene. The other video on medicines, the first video, talked about good amygdala management and what that might look like or begin to look like. Well, it includes things like cardio, a lot of cardio, making sure you're doing about an hour, 45 minutes to an hour a day, really. Get your heartbeat rolling. It helps to metabolize all of the adrenaline, cortisol, norepinephrine, and so forth that's in your bloodstream. It helps you to feel better. It also helps you to sleep better. You feel more relaxed afterwards. You feel less tension. So get moving. It completes the anxiety circle. What would be other parts of good amygdala management? Well, good sleep. So I want to make sure that my sleep hygiene is really cleaned up. What's sleep hygiene? What does that mean? Well, it means having a good routine. It means not taking naps all throughout the day, right? There's an urge and an urgency, a little bit of an urge with folks who have anxiety to want to take naps. And I had it too. I know what that's like. But don't take it. Save up your sleep deficit for at night so that you can sleep well at night. It also throws off your circadian rhythms and so forth when you're taking naps throughout the day. I understand that a lot of you are exhausted. Totally get that. I totally get that, it's really hard. And you want to maybe sleep in. If you fell asleep late, you want to sleep in. No, good sleep hygiene includes getting up at a certain time. I'm going to get up every day at 9 o'clock or 8 o'clock, and I'm going to start my day, regardless if I have that pit in my stomach, regardless if I have that just, oh my God, I can't get out of bed. I feel like just a pit in my stomach. I feel all this dread for the day. I totally get that. I experienced it too, but I'm going to tell you, it will not go away in bed. It does not go away in bed. One of the best things you can do is get yourself out of bed and get your body moving so it metabolizes those stress hormones. There's something called the cortisol awakening response that happens all the way throughout the night. Cortisol levels, which is one of the stress hormones in the body, builds throughout the entire night and goes all the way until it reaches its peak between 5 and 7 a.m. That's when people get that pit in their stomach. And that feeling of dread and the feeling of foreboding, and that something bad is going to happen in the morning, that they wake up, that dreadful morning feeling. Everybody always asks me, how do I get rid of that? And this is part of the way. You do not stay in bed. Do not stay in bed. So that's part of good sleep hygiene too. We want to get up at a regular time. We want to go sleep at the regular time. We want to make sure that all of the time leading up to sleep is really spent not on screen. I'm not picking this up and going through TikTok and and Facebook, and I'm not lighting my face up with blue rays. We already know that the research already shows that throws your circadian rhythms all off. Being in front of a computer will do it. Being in front of a TV screen will do it. Some of you will say, oh, but I fall asleep. That's how I fall asleep, is with white noise. Good, then get a Homedics white noise maker and put that next to your bed and get the TV shut off, get the extraneous lights shut off so that you can start to regulate your sleep a little bit better. I want to prepare myself with a sleep routine as I go through for an hour before I'm about to fall asleep. So I want to make sure I take a hot bath, raise my core body temperature. I want to make sure that I get a little snack in there, maybe some carbohydrate, a little cookie or cracker or something, maybe a little tiny bit of ice cream, a little tiny bit, and then get some tryptophan in there if I can get it with a banana or something like that. I want to make sure that I'm setting myself up to fall asleep well. So that's part of good amygdala management. So you got cardio, you got good rest, you got medicine is actually part of good amygdala management. So, and I also want to manage the outside stress in my life. I want to manage and make sure that I'm responding the way I need to so that there's not chronic stress just driving my anxiety. So I need to take care of the problems. I need to get them taken care of and squared away. That's good amygdala management. I'm not letting stuff sit. I'm not letting stuff fester. I'm not letting shit build up. I am taking care of it. I'm managing it. I'm moving towards it. Because a lot of you will feel like, I don't want to do that. I can't handle it right now. I just can't handle it. No, that's bullshit. You can handle it, and you need to handle it in order to get that out of the way so that it's not driving your adrenal system the whole time. So what I'm about in all anxiety treatment is about this is that you can handle more than what you think. You think that you're super fragile. You think that you can't handle it. You think you're going to fall apart. You think you're not going to be able to do it. That's bullshit. You can handle it. You can handle it. That doesn't mean we go and jump into the deep end of the pool and take on all of our fears all at once. No, but you can handle more distress than what you think you can. You can handle more distress than what you think you can. And that is actually how you start to get rid of some of this anxiety is by doing some things that are a little bit uncomfortable sometimes. Actually taking care of, paying the bills, actually taking care of going and, getting some groceries or going to the local dollar store and getting the things I need there at night, maybe when it's less busy and so forth, when I can go in there and I can get out of there really fast if I feel more anxiety. So that's part of good amygdala management too. So then sort of circle back. So we can use good amygdala management as a way to help manage our anxiety and to kind of get our brain in the right space to be able to do good anxiety counseling and anxiety therapy and anxiety treatment. We do that. And we use medicine in the same way to set our brain up the right way. In the last video, so some of you too are looking at this and you might have post-traumatic stress disorder or acute stress disorder. So you might have symptoms where you saw something traumatic or saw several things that were traumatic and maybe got overwhelmed with normal physiological response. I can't sleep. I'm having flashbacks. I can't, I feel like I'm going to jump out of my skin. I constantly feel like dread. I constantly feel on edge. I'm getting angry at people. I'm getting really pissy with everybody. So now at that point, those are all the intrusive thoughts, intrusive dreams, nightmares. Those are all indicators of post-traumatic stress disorder, something going on with that. We do see nightmares and other anxiety disorders too, to a degree, but it's a lesser degree. With PTSD, it's really intrusive stuff. Now, usually you'll see these other kinds of medicines starting to be used to that. Sometimes we'll use a medicine called Pitocin. Pitocin will help with nightmares and so forth. So, and again, this is not medical advice. I can't tell you what to take and what not to take. I'm going to tell you from my experience what I've worked with other physicians and using. Then you take this and then you go talk to your own physician and you talk to your own professionals and then you work with them as a team on what it is that you maybe need to take and maybe need to consider to take. So sometimes with PTSD or trauma-based anxiety, we'll use things like Pitocin for sleep. We'll use quetiapine to help fall asleep. We'll use another medicine. Used to be called Deseril and Trazodone. We use those medicines. Those can help with sleep and to a degree with anxiety. And a lot of people get all tangled up in that. Oh, well, the Trazodone is an antidepressant. Why don't I have depression? I have anxiety. Well, yeah, no. It just turns out that's the vernacular we use. Trazodone is just a good medicine to help you sleep, and it's also a good medicine that helps in certain aspects with anxiety, as does quetiapine or Seroquel. Those medicines really can help. Some of these medicines, when they're combined with other medicines together, they make incredible hard-hitting medicine for anxiety to help it go away or to help at least in your treatment process and how you begin to get better, how you actually do that. So for some of us, what we need is we need medicine to get us into a place where we're actually willing and feel like we can handle doing a little bit of the work that it requires. And the work, what is the work? What's the work? Well, the work to get over anxiety, it isn't learning how to ground, and it isn't learning how to breathe, and it isn't how, I get really bristly about this. Because there's a lot of people that say, "Oh, come to my, therapy, and we'll show you how to ground yourself." You don't need to ground. What you need to do is start to progressively face some of the things you're afraid of in little tiny doses, right? So the gold standard treatment that I use with all of my clients, and that has all the research behind it, and it has research all the way across all the anxiety disorders, every single one of them, including PTSD. It's effective. This method is effective for OCD. It's effective for panic disorder and panic attacks, for chronic anxiety, for illness anxiety, for social phobia, for social anxiety, for generalized anxiety disorder and constant worry. So what is it? What's the drum roll? What works for these is exposure therapy. That's what works. Some people have this vision that somehow we just take you and throw you in whatever you're scared of and then leave you, and then hopefully that works. No, that is not what exposure therapy is at all. It's actually, when it's done very well, it's very gradual. You have full control of the whole thing. You guys will have control over what you expose yourself to and when and to what degree. And we usually start out really small, like stuff that causes anxiety in the 20s or 30s, little experiments just to get you guys used to it, get you guys used to what works, so you can actually watch what happens through your anxiety. It will, when you're using good exposure therapy, and that is the gold standard for years now, maybe 50, 60 years now, that's what takes anxiety away. It is not learning how to ground yourself. It is not learning how to deep breathe, and it is not learning mindfulness. I'm a mindfulness teacher. I'm a meditation teacher. I teach it. And I can tell you, I became an expert meditator trying to seek how to stop this stuff. And here's the clue. It doesn't stop this. Being a good meditator does not stop an anxiety disorder. You need very specialized techniques, very specialized direction from a therapist that knows what they're doing. Now, we'll cover that in another video, like how do you know if you have a good anxiety therapist? We're going to talk about that too, because I'm tired of people bullshitting people. Get a little bristly, right? A little bristly. But I want to talk the truth. I'm never going to sit here and tell you a lie. I've got 25 years experience behind this and what works and what doesn't. And then I have my own personal experience. Not only am I a therapist, but I went through my own recovery journey with this. So I had to learn what works. I had to learn what actually helps. So at any rate, that's what I wanted to say a little bit more. I wanted to say a little bit more about medicines. Hopefully that gives you what you need, and you understand a little bit more about, sometimes the medicines will be used in combination, and ideally medicine should be used as a shorter term solution. So antidepressant maybe for a year, maybe 6 months to a year, tops. And then with the right therapy and the right help, you can be kind of with the right help and the right therapy. That's my wife trying to disturb me. With the right help and the right therapy, you can have your anxiety start to come down, and then you can come off the medicine. The medicine isn't designed for you to be taking it as the solution, and unfortunately a lot of people get stuck there, like this is the solution. No, it's not. That's bullshit too. That's not true. You can actually get better, and you could do it. You can literally do it without medicine. It's a lot of hard work, but doing it with medicine will make it easier, but you're not supposed to be on the medicine for your whole life. You're not supposed to be in the medicine your whole life. And that includes antidepressants and benzodiazepines and all the other medicines. So there you go. Hopefully that helps. I will see you in the next video.